Doctors in Japan are using a simple blood test to predict heart attacks 10 years before they happen. But here's the part that shocked me. Two specific numbers from this test can tell you if you're at risk, and one of them has nothing to do with cholesterol. I'll tell you what those numbers are, and one real story that proves why this matters. If you're over 50, you probably know someone who's had a heart attack, maybe a friend, a family member, or maybe you've had one yourself. Heart disease is the #1 killer. But here's what most people don't realize: that sudden heart attack. Your body was warning you for years, you just didn't know what to look for. This Japanese test catches those warnings. And by the end of this video, I'm going to tell you about a 58-year-old man who felt perfectly healthy, took this test, and discovered something that would have killed him within 3 years. His doctor changed just 2 things, not medication, not surgery, and 5 years later, he's completely healthy. But first, let me explain why our current tests are missing the real danger. The problem. Here's what's terrifying about heart attacks. You can have perfect cholesterol numbers, and still drop dead from a heart attack. How is that possible? Because cholesterol is only part of the story. Your arteries can be inflamed, building up microscopic damage for decades, and your cholesterol test won't catch it. Your stress test won't catch it. Even your blood pressure might look normal. The real killer. Inflammation and plaque buildup happening silently, at the cellular level. By the time you feel chest pain, your arteries are already 60, 70, sometimes 80% blocked. Now here's the breakthrough. Scientists in Japan discovered 12 specific warning signals in your blood that appear years, sometimes a full decade, before any blockage forms. And 2 of these signals are so accurate that if your numbers are high, doctors can predict with 90% accuracy whether you'll have a heart attack in the next 10 years. I'm going to tell you what those 2 key markers are in just a minute. But first, you need to understand why this changes everything. The breakthrough. Here's how this test works, and I promise, it's simpler than you think. You get a standard blood draw. 5 minutes. Nothing invasive. The lab analyzes your blood for 12 biomarkers. Now, all 12 matter, but there are 2 that stand out as the most powerful predictors. The first one measures inflammation in your artery walls. Think of it like rust forming on metal pipes. You can't see it from the outside, but it's weakening the structure from within. The second marker detects a specific type of cholesterol particle, not your total cholesterol or LDL cholesterol that your regular test measures, but a particle called lipoprotein A. Most people have never heard of it, but high levels are one of the strongest genetic risk factors for heart disease. If both of these markers are elevated, your risk jumps dramatically. Now here's where it gets interesting. An AI algorithm takes all 12 markers and calculates your exact risk score for the next 5, 10, and 15 years. The test was validated on over 50,000 people in Japan. And here's the stunning result. People who tested high risk and made changes based on the results. Their heart attack rate dropped by 70%. But you're probably wondering, what kind of changes? What did they actually do? I'm going to tell you in a moment, and I'll share that real case I mentioned earlier. But first, let me address the question I know you're asking. Quick pause. If you're finding this valuable so far, do me a favor and tap that like button. It helps more people see this information, and honestly, it might save a life. Okay, let's talk about who should get this test, and this is critical. Who needs this? If you're over 50, you should consider this test. But here are the red flags that mean you absolutely need it. Family history of heart disease, your parents, siblings. High blood pressure, even if it's controlled with medication. Diabetes, or prediabetes. High cholesterol. Smoker, or former smoker. Overweight, especially around your midsection. If even one of these applies to you, this test could be life-saving. Now here's the frustrating part. The test isn't widely available in the United States yet. But, and this is important, there are things you can do right now that give you similar information. But first, let me tell you that story I promised. Because this is where it gets real. His name was Hiroshi. 58 years old. Active guy. Played tennis twice a week. No symptoms. Felt completely fine. He took this blood test as part of a routine physical in Japan. When the results came back, his doctor called him in immediately. 2 of his markers were dangerously high. His inflammation marker was 3 times the normal level. His lipoprotein A, that special cholesterol particle, was through the roof. His regular cholesterol? Totally normal. His blood pressure? Fine. If he'd only gotten a standard checkup, his doctor would have told him he was healthy. But this test saw the truth. His doctor ordered an angiogram, a scan of his arteries. What they found shocked both of them. A 70% blockage in his left anterior descending artery. That's the artery they call the widowmaker. Without symptoms. Without warning. Now here's the part that matters. His doctor didn't immediately rush him into surgery. Instead, they made 2 specific changes. I'll tell you what they were in just a second, and they monitored him closely. 5 years later, Hiroshi got the test again. His markers had dropped to normal. His blockage had actually reduced to 40%. No heart attack. No surgery. Just 2 changes that saved his life. So what were those changes? The 2 changes. Change number 1, medication. His doctor put him on a statin to lower his cholesterol, and a low-dose aspirin to prevent clots. Nothing extreme. Just targeted medication based on his specific risk. Change number 2, diet and exercise adjustment. Not a total life overhaul, he was already active. But they targeted inflammation specifically, more fish, more vegetables, less processed food, and added an anti-inflammatory supplement, omega-3 fish oil. That's it. 2 changes. Based on 1 blood test. And it saved his life. What you can do now. Now, you're probably thinking, okay, this test isn't available here yet. What can I do today? Here's exactly what to ask your doctor for. First, advanced cholesterol testing. Specifically, ask for an ApoB test and an Lp(a) test, lipoprotein A. These aren't standard, but they're available at most labs. Your doctor just has to order them. Second, ask about an inflammation test called HSCRP, high-sensitivity C-reactive protein. This measures inflammation in your body, including your arteries. Third, consider a coronary calcium scan. It's a CT scan that shows calcium deposits in your arteries. It costs around $100 to $200, not usually covered by insurance, but it's one of the best predictors we have right now. And fourth, if you're high risk, talk to your doctor about statins and low-dose aspirin. These are proven to prevent heart attacks in high-risk people. Now, when is this Japanese test coming to the United States? Based on FDA trials currently happening at the Mayo Clinic and Johns Hopkins, most experts predict approval by late 2025 or early 2026. It'll start at major hospitals and gradually expand. Cost will probably be $200 to $500 initially, not covered by insurance at first, but as it becomes routine, insurance will start covering it, especially for high-risk patients. Compare that to the cost of a bypass surgery, $100,000 or more, and this test is a no-brainer. This is the future, catching the problem before it becomes a crisis. Preventing the heart attack, instead of surviving one. If you're over 50, share this video with someone you care about. Early detection saves lives, and the people you love need to know this exists. And here's my question, would you get this test if it were available today? Drop yes or no in the comments, I want to know. If you want more breakthroughs like this, hit subscribe. We cover life-saving discoveries every single week. And watch this next video, it's about another breakthrough that could add years to your life. This is Lab to Discovery. Take care of your heart, and I'll see you in the next one.